Hello, my name is Patrice Williams. I am coming to you from with Vaccinate Solano. I am so excited. Today we have Dr. Bela Matyas. He is our public health director for Solano County, Solano Public Health. I am so glad to see you here, sir.
Thank you. Thank you for inviting me.
Oh, of course, when we want to know information, we know to call your office because you always come to us with a straight talk. And that's what we need at times like this.
Thank you. So, did you want me to go ahead and give a quick update?
I want to know the quick update.
Okay. So COVID disease in our county is continuing along at a higher rate than we would like. I mean, you know, we would love to be able to move from the red tier into the orange tier, but our numbers for the past 2 or 3 weeks have been too high. I mean, they're good for red tier, and you know, so that's good. I don't think there's any danger of going back up into purple, but we're not showing any signs of moving into the orange tier either. You know, and so that's tough on our businesses because there are restrictions on them because of the tier that we are in. Nonetheless, in the meantime, we have been doing a better and better job of vaccinating people in our community. As of yesterday, we have given at least 1 dose of vaccine to 50% of the county's adult residents. So if you know, we're thinking about people 18 and over. Of them, there are about 350,000 who live here in Solano that are in that age group, and we have vaccinated half of them. And about 32%, almost a third of the adults are fully vaccinated. So we are definitely making progress. And unfortunately for us, we've not been receiving vaccine allotments that are adequate. I don't think any county believes that they've been getting enough. And, you know, it's certainly true for us. We could easily vaccinate 4 or 5 times as many people every week as we are getting vaccine for. But we're just doing the best we can. So what we're getting, we're using, and every week we vaccinate, you know, 5 or 10,000 more residents, and you know, hope that we will be able to give vaccine to everyone who wants it within the next few weeks.
That's great news. What is the goal? What is our goal vaccination number where we feel like, okay, we're in a very safe position in Solano?
That's a tough question to answer. So I'm going to answer it 3 ways. If the goal is what's called herd immunity, to really prevent spread from one person to another in our community effectively, we need to get about 80 to 85% of all of our residents vaccinated. That's not going to happen.
Oh.
If we're thinking about a reasonable goal based on the refusal rates and the fact that, you know, there are some people who just aren't going to want to be vaccinated, you know, what's a reasonable number we believe we can achieve? I think it's probably about 2/3 of the adult population. So we're targeting 225,000 tentatively as our goal. But the true goal is to make sure that everyone who wants vaccine and everyone who's hesitant that we can persuade to want vaccine gets vaccine. Because what you'll be left with in that situation is a community where the only people not vaccinated are the ones who don't want vaccine. So they're basically saying they're willing to take the risk of the disease, and they're okay with that. And so in that situation, we have done the best we can for our community. Because we're not, this is a voluntary situation. We're not going to make people be vaccinated. So our goal is to educate and give people the information they need. If they're hesitant, help them get over that hesitancy and get vaccinated. But we have to respect people's individual choice. And a lot of people are going to say no. And in some of our counties, that's going to be as much as 50% are going to say no. And then there'll be places like San Francisco where probably 85, 90% will say yes. So, Solano County is a blend. And I think if we're going to be honest with ourselves, getting to about 60, 65% might be the best we'll get.
Okay. Who are we? I'm impressed by the numbers. When I looked at the dashboard, and by the way, we'll post that link to the Solano County dashboard. I was really surprised by the numbers of where we were here in April. But also I thought, who are we leaving behind? Are we leaving behind the homeless community? Are we leaving, who are we leaving behind? Do you have a sense of that? I can't tell by the dashboard.
I mean, it's hard to tell by looking at the dashboard. The dashboard doesn't give enough information for that. And you should know that the dashboard right now only shows the vaccinations we have given as a county. So we give that to people who live and work in the county. That's not a dashboard of our residents. We're going to be adding that to the dashboard in the next week or so. So there'll be a lot more information on there, and you'll be able to see how many residents are vaccinated, which is 50% right now, and then how many people we provided vaccine to, which will be a similar number, but it won't be all residents because we vaccinate people who live or work in our county. We do know that so far we have gaps in the homeless, in the homebound, people who are homebound. We also have gaps in certain communities in our county that have difficulty with access, that are poor, where we have not had the opportunity yet to do a pop-up clinic in that community. And so those are areas currently being left behind that we are actively coming up with strategies to address. And then the other group that I really want to put energy into are those who are hesitant but haven't said no. Because those are people that I think are looking for information, they're looking for reassurance, and if we can give them that information and that reassurance, then hopefully they'll say yes. So our strategy at the beginning was to first we went into the long-term care facilities because that's where the highest risks are. And we took care of them first, made sure they were okay. And then we did a combination of pop-up clinics and mass vaccination clinic at the fairgrounds. And right. The idea there was those people who really want it, let's just get through them as quickly as we can, get them out of our way, start to focus on people who are a little bit trickier to work with. And that's what the small pods and the community pop-ups are for. So what you'll notice is lately we've been focusing a lot more attention on clinics at churches, at community centers, at senior centers, and we're trying to spread it all over the county, like 500 or 1,000, not 10,000 in a day, but in a community of need. And I think we will be continuing to do that for the next couple of months until we basically get nobody signing up anymore. And then separately, we have been focusing on senior housing complexes where people have mobility issues. So we go to the complex, and we've been to all of those, and we've covered those so far. And then the other group that we're just starting, two other groups that we're just starting. One is the homebound. These are people who really just can't leave their home. And so we're going house to house to vaccinate them.
That's amazing.
Well, I think all of the counties are doing similar things. I mean, I'm proud of my staff, very proud of what they're doing, but I don't want to take credit for ideas that nobody else is doing too, because I mean, pretty much all of us are doing the same kinds of strategies. And then the other group is the homeless. And the homeless, what we have been held up on is the problem with the Johnson & Johnson vaccine. Because for the homeless and transient populations in general, you can't guarantee a return. So it's important to use the one-dose vaccine for those types of populations. And really, the use for the Johnson & Johnson vaccine, in my opinion, is for highly mobile populations where it's hard to assure that they can come back. For the jailed population, for the same reason, because they turn over pretty rapidly. And then for anyone else in our community who prefers one dose over two. So those are the groups we want to use it for. We did get started with the jail, and we made good inroads. Everybody who wanted vaccine received it. But we keep hoping that more will want it. So we keep working on persuading the inmates who are hesitant. The one group we have not started with yet is the homeless, because we were just getting ready to start when the hold was put on the vaccine.
Well, let's talk a little bit about that. The Johnson and Johnson recall hold that has been pretty high in the news.
Yeah.
And so, has that hold been released?
No, not yet. The CDC, the federal government, is looking at information from all over the country. They're trying to make sure they have a better understanding of how much blood clotting problems are occurring. So they were made aware of 6 cases in the first 6.8 million doses. So in the first 7 million doses delivered, there were 6 cases reported. But this is not the kind of a condition that you would automatically associate with a vaccine. So they're giving doctors a chance to think about, well, have I had any patient with a similar situation who got vaccine and I didn't think about it? Let me report it. And they're waiting for all that information to come in to take a look at just how many actually occurred. And then they can decide, is this a very rare idiosyncratic, in other words, related to your genetics, and that, there's no way of predicting it. Is this just a really rare random event, or is it common? And if it's not a rare event, then they may feel uncomfortable releasing the Johnson and Johnson vaccine. Whereas if it's really rare and just random, then it's like, well, there's really, it's not really telling us about the vaccine. It's telling us about people, and there's not really anything we can do about that. It makes sense to release the vaccine, because the problem here is that we have to weigh the benefit of a vaccine against the risks of harm caused by the vaccine. And I think that if we're going to be honest, there is no such thing as a vaccine that never causes harm. That's not real. There's always going to be someone allergic to any vaccine that we manufacture. And the issue is, how common or how rare is that problem compared to the problems caused by the disease itself? And this is where it gets really tricky, because all of us have our own idea of how we balance risk. Some people say, you know what, it's natural to be exposed to this. I'm going to take that risk. There's no way I'm taking a human man-made risk of any sort. I'm going to take this other risk. Other people look at them and they compare. So let me give you the numbers just for a comparison.
Okay.
COVID patients, people who have COVID disease, about 1% of them to 2% of them die. That means that 1 of every 100 to 1 of every 50 people who get the disease die of the disease. Now, let's be honest, that's only people we know about. So there's probably a lot of people who get the disease that are asymptomatic and they don't die. And so maybe that's a bit of an inflated number. So let's say it's 0.5%. Let's say that it's 5 out of every 1,000 who die. So far, with regard to the side effect, it has affected, not killed, just affected 1 in a million people. So that means that the risk of dying from COVID is 1,000 times higher than the risk of a blood clot from the vaccine. So that's kind of a big difference. Getting a blood clot that you don't necessarily die from versus actually dying, 1,000 times more likely to die from the disease than to have a problem from the vaccine based on what they observed. And that's, so to the CDC, that's what they're going to look at. And they're going to say, well, of course, 1,000 times better is better. Like, why wouldn't that be okay? So I suspect that unless a lot of these cases get reported, that they're going to say, yeah, the vaccine's okay. And this is really the same thing that happened with the AstraZeneca vaccine in Europe. They went through the same process and they came to the same conclusion. They haven't decided this yet at the ACIP. It's up to them to decide. They haven't told us when. We're just in a wait and see. But what this whole process has done is it has cast doubt on the Johnson & Johnson vaccine. And we have to own that. That's truth. And add to that the fact that some people feel that it's not as good as the 2-dose vaccines because it only provides, it provides complete protection against death, but it only provides about 85% protection against disease, and the 2 doses provide 95%. Well, obviously they're better. And so we have to be really careful as a health department on how we use this vaccine. The last thing we want to do is make it be the only vaccine available to people who are hesitant about it. So everyone should have the opportunity for a 2-dose vaccine, not just a 1-dose vaccine. The problem is not everybody is in a situation where that makes sense. So for the homeless, it kind of doesn't make sense. For the jailed population, it doesn't make sense, because you have to be there and findable 3 weeks later or 4 weeks later.
Right.
Or the one dose of a 2-dose vaccine is nowhere near as good as the one dose of the Johnson & Johnson. So the thing with the Pfizer and the Moderna is you need both for it to give you that level of protection, whereas Johnson & Johnson does its thing with one dose. And if it is in fact safe, then there's really not a reason not to use it. But the challenge here is making sure that we weigh that reality against your right to feel uncomfortable with it. And so I don't think there's any way we're going to get past some people being uncomfortable with Johnson & Johnson, even if the ACIP says it's perfectly safe. Because it's not perfectly safe. Nothing is, and I think that's an exaggeration. It's not perfectly safe, obviously. On the other hand, it's really not a bad vaccine. It's a really good vaccine. But if you have choice, why not go for another one? That's fine. I think that makes perfect sense. I apologize if that was a long-winded and
No, you know what? You always educate and inform. So I appreciate it. And for me, I know I as the person receiving the information, I always go back to our episodes and re-listen to them, because you pack the episode so full that I have to kind of process. Someone else must have told you that before too. Yeah, you give us so much to unpack, which I appreciate. I'd rather have more information than less. But I tell you, what I've been hearing back in particularly the Black community and maybe other communities, just people that were worried, period. They were able to hang their hat on the Johnson & Johnson recall and say, see, there's probably a problem with Moderna and Pfizer too. Or see, these people are sick afterwards. There's side effects. It almost gave them something, it kind of gave a face to other concerns.
And the thing is, all of that is valid. And the problem is human beings are wired with what is called confirmation bias. We have a preconception and we look at information to support our preconception. We're not objective. We are the opposite. We are a very subjective species. And if you have fear, you will look for evidence to support your fear. If you don't have fear, you look at evidence not to support it. And you could just as easily say, wow, if you're willing to put a hold on a vaccine for a 1 in a million level of risk, you are so careful, you are protecting me beyond my wildest dreams. That's just as valid as saying, oh, look, it had a problem. And the reality here is people are going to think what people are going to think. And it's not my place to tell you what to think. My place is to give you information and allow you to do what you think is best. The caution I would put out there is, if you are concerned about the vaccine, then you should at least be mindful of the disease, because the disease kills. The disease maims, the disease hospitalizes, the disease causes long haul disease where you have symptoms for months and months, maybe for the rest of your life. Those things are real. Those things don't go away just because you have fears of the vaccine. And so you have a choice. You have a choice you can make. You can face the risks of the vaccine, or you can face the risks of the disease. Your call. And my job is just to give you access to the vaccine if you choose to take that path. But don't fool yourself. This is not a trivial disease. And at the same time, there's no such thing as a vaccine that's not going to cause pain. I mean, when you inject into the muscle, it hurts. And virtually virtually everybody has pain at the site of injection. You better, or I didn't inject anything. As for the issue of, especially with the second doses having these side effects, it's your body telling you it's working. So yeah, you kind of want something, so your body's telling you it's working. And I think if people realize that that's how it's supposed to be, then it might not be so fearful. The problem is public health officials aren't very good about being honest. I cannot inject you and not hurt you. It's just the way it is. I'm sticking a thin steel pin into your body. Of course it's going to hurt. And then I'm injecting fluid. Where do you think the fluid goes? Goes in your muscle. What do you think happens? It's going to hurt. And then your body reacts because your body has to produce antibodies. Well, it can't do that without reacting. So of course you're going to have something. But that's good. That's normal. And it lasts for a short period of time. By contrast, I'm looking at death reports every day of people who lingered in the ICU on a ventilator for 6 weeks, 8 weeks, their families suffering throughout that entire time period, and then they ultimately succumb to the disease and die. It is an ugly way to go. I don't think there's any good way to die, but this is not a pleasant way to have to be hospitalized or to die. And so that's what the disease does. So you have to decide what's better for you, the disease and what it does, or the vaccine and what it does. And this is where it comes down to personal choice. And I want to be really careful not to be judgmental. I have full respect for anyone who doesn't want to be vaccinated. That's okay. My issue is, do you have enough information to make that decision? If you do, cool. Whatever you decide, you decide. We live in a democratic society. It's your call. There is a higher proportion of hesitancy in certain racial ethnic subgroups. And that's shame on us for having created a world where that is our reality. Shame on us. And I cannot deny it, and I cannot hide from it. The best that I can do is ask people like you and others who the community trusts to be an intermediary. You absorb information and you can then translate it in a way that people do or don't trust. And look at me, I'm a white guy. I have no right to speak to non-white people about their experiences. And I don't pretend to have the right to do that. But I also have a responsibility, which is to protect everyone's health. And so, working with individuals like yourself, Kay, Patrice, and others is the method that we have to follow to try to help people appreciate truth. But you know what, even with all of that work, there are going to be people who say, no, thank you. And that's why I think it's going to be really, really hard to achieve enough vaccination for genuine herd immunity. We don't get it with flu, and we've been dealing with flu for our whole lives. We aggressively try to vaccinate people every season for flu, and we're lucky if we vaccinate 50% of the public. So, if I'm going to be realistic, we're not going to achieve herd immunity, but we will be able to vaccinate all of those people who want it.
Who want it? Who want it? And by when? Do we have a time?
Much sooner than we thought, much sooner than we thought. Here we are in April, and we've already vaccinated 50% of the community. And if our goal is 2/3, well, we're already 2/3 of the way to our goal. We're making huge progress.
Right. And I love the age, how we were able to go down in age.
Yeah, everybody's eligible now that the vaccine is safe for. So I think that there are going to be stragglers. So, I think we're not going to get to completely vaccinating everybody who wants it before the middle of summer, because I think there's just a lot of stragglers, and there's people that are harder to reach and people who need a little bit more convincing. And we're going to be persistent until people say we're done. But I think the vast majority of those who want vaccination will have received it probably by mid-May.
Will we need to have boosters on an annual basis?
That's an excellent question. Now think about all the vaccines we get. Some of them, like the measles, mumps, rubella, we do it in childhood and we don't need reboosting. Others, like pertussis, we need it every 10 years. Tetanus, we need it periodically, right? Pneumococcal, we need it twice in our lifetime. Influenza, we need every year. So the jury is out on where in that spectrum COVID is going to fall. It's going to be somewhere between once is enough to every year. Probably won't be more than that. It doesn't make sense, because really what you would do is vaccinate when it's cold and flu season. It is possible that it will become an annual vaccine the way influenza vaccine is. But it's also hopefully possible that it'll be less frequent. We just don't know. It's brand new, and we have no idea how long the vaccination is protecting people, because they've just been vaccinated.
So if someone is watching and they're like, this was great information, I want to be vaccinated, what would they do?
So what we ask them to do is go on our public health website. We have a COVID website, and sign up for the My Turn as well as for the county vaccination clinics. And we will tell you when there are clinics available. So, you sign up, you give us your phone number so we can text you, or an email so we can email you. And then we send that back to you as soon as there's a clinic that you are eligible for. And since everyone's eligible, we basically send it to the whole group every time there's there's an available clinic. And lately we haven't had many because of the vaccine shortages. We're all suffering through vaccine allotment shortages, but we're being told that that's going to turn around, and there should be more vaccine available in the next few weeks. And so there'll be more opportunities for people to sign up. And And that way you don't have to keep track of where the clinics are, because you'll be notified when the clinics are available.
Right, right. This has been amazing. I appreciate your time and bringing this information. I mean, we literally called you and your team said immediately, he's coming on and he's gonna talk to you guys.
But this is important. This is very important information to get out to folks. And I appreciate very much the opportunity to speak with you about it.
Well, I appreciate you always.
Thanks.
Well, thank you. Thank you, Dr. Bela. This is Vaccinate Solano. And we're going to be putting the links in our video here. And Dr. Bela, can we call on you again if there's more updates?
Yes, absolutely. Absolutely.
Okay,
and let's keep our ears to the ground on when the Johnson & Johnson vaccine gets released. And then those people who are still wanting it, we'll make it available.
Sounds wonderful. Sounds good. Thank you.
Take care. Bye-bye.
Bye now.